If you're new to Medicare, the first thing that trips people up is the letters. Part A, Part B, Part C, Part D. What do they all mean? And do you need all of them? By the end of this video, you'll know exactly what each part covers, what it costs, and how they fit together. Let's start at the beginning. Part A is your hospital insurance. Think of it as your coverage for when you're admitted, when things get serious enough that you need to be in a facility. Part A helps cover inpatient care in a hospital, skilled nursing facility care, hospice care, and home health services. This is called premium-free Part A. Most people qualify. If you're not sure, you can check at ssa.gov or call Social Security. But premium-free doesn't mean everything is covered at no cost. When you're admitted to a hospital, your costs are measured in what Medicare calls benefit periods. Each benefit period starts when you're admitted and ends when you've been out of the hospital for 60 days in a row. At the start of each benefit period, there's a deductible. In 2026, that's $1,736. After you pay that, here's how your hospital days break down. Days 1 through 60, you pay nothing. Days 61 through 90, you pay $434 per day. Days 91 through 150, you pay $868 per day. These are called your lifetime reserve days, and you only get 60 of them total. After day 150, you pay all costs. Most hospital stays are short, but it's important to know these numbers so you're not caught off guard. Part A also covers skilled nursing facility care, but only under specific conditions. You need to have a medically necessary inpatient hospital stay of at least 3 days first. Then, if your doctor certifies that you need daily skilled care, like intravenous medications or physical therapy, Medicare can cover your skilled nursing stay. Days 1 through 20 of skilled nursing care, you pay nothing after the deductible. Days 21 through 100, you pay $217 per day. Day 101 and beyond, you pay all costs. This is not the same as long-term custodial care. Medicare does not cover nursing home care when you just need help with daily activities. Now let's talk about Part B, your medical insurance. Where Part A covers hospital stays, Part B covers the ongoing medical care that happens outside the hospital. Part B helps cover services from doctors and other healthcare providers, outpatient care, durable medical equipment like wheelchairs, walkers, and hospital beds, and a wide range of preventive services. Unlike Part A, Part B does have a monthly premium. In 2026, the standard Part B premium is $202.90 per month. Most people pay the standard amount. However, if your income is above a certain level, you may pay a higher amount. This is called IRMAA. Part B also has a yearly deductible. In 2026, that's $283. After you meet that deductible, Medicare pays 80% of approved costs and you pay 20%, as long as your provider accepts assignment. There is no yearly cap on your 20% under original Medicare alone. That's one of the reasons many people add supplemental coverage. Here's something important about Part B preventive services. For most covered preventive services, things like mammograms, colorectal cancer screenings, flu shots, and your Welcome to Medicare visit, you pay nothing as long as your provider accepts assignment. Medicare wants you to catch things early. Use those benefits. When you turn 65, you have what's called an initial enrollment period. This is a 7-month window. It starts 3 months before your birthday month, includes your birthday month, and ends 3 months after. If you sign up in those first 3 months, Your coverage starts the first day of your birthday month. If you're already getting Social Security benefits when you turn 65, you'll get Part A and Part B automatically. Your Medicare card will arrive in the mail. If you're not getting Social Security yet, you'll need to sign up yourself at ssa.gov. This is important, so pay attention here. If you miss your initial enrollment period and don't have a qualifying reason to delay, you may pay a late enrollment penalty on your Part B premium. For every 12-month period you could have had Part B but didn't sign up, your premium goes up 10%, and that increase stays with you for as long as you have Part B. The Medicare and You Handbook uses Mr. Smith as an example. His initial enrollment period ended in December of 2021. He waited until March of 2024 to sign up. That's 2 full 12-month periods. So his Part B premium is permanently 20% higher. The exception: if you're still working and covered by employer health insurance based on active employment, you can often delay Part B without a penalty. But COBRA and retiree coverage don't count as active employer coverage. If you're in that situation, talk to your state health insurance assistance program before making any decisions. Now let's talk about Part C, also known as Medicare Advantage. Here's the simplest way to understand it. Medicare Advantage is an alternative way to get your Part A and Part B coverage through a private insurance company that Medicare has approved. Instead of getting your benefits directly from the federal government, you enroll in a private plan that bundles together your Part A, Part B, and usually Part D drug coverage. Medicare Advantage plans often include benefits that original Medicare doesn't cover. Things like vision, hearing, dental care, gym memberships, and transportation to doctor visits. Many plans have a $0 monthly premium beyond what you already pay for Part B. And unlike original Medicare, Medicare Advantage plans have a yearly out-of-pocket maximum. Once you hit that limit, the plan pays 100% of covered services for the rest of the year. That's a protection original Medicare alone does not have. But Medicare Advantage has trade-offs worth knowing. Most plans have networks. In many cases, you'll need to use doctors and hospitals inside the plan's network, especially for non-emergency care. You may need referrals to see specialists, and you may need prior authorization before certain services or medications are covered. Every Medicare Advantage plan is different. Costs, networks, and extra benefits vary widely, and they can change year to year. The bottom line: Medicare Advantage can be a great fit for some people and not the right fit for others. It depends on your doctors, your medications, and how you use your health care. Now let's talk about Part D, your prescription drug coverage. Part D helps cover the cost of prescription drugs, including many recommended vaccines. Part D plans are run by private insurance companies that follow rules set by Medicare. If you have original Medicare, Part A and Part B, you don't automatically have drug coverage. You'd need to join a standalone Part D plan separately. Most Medicare Advantage plans include Part D drug coverage already built in. Part D costs vary by plan, but here's the general structure. Most plans charge a monthly premium, and most have a yearly deductible, the amount you pay before the plan starts covering your drugs. After the deductible, you pay co-payments or co-insurance for your medications, your share of the cost at the pharmacy. Here's a significant change in 2026. Your total out-of-pocket drug costs are now capped at $2,100 per year. Once you hit that limit, you pay nothing for covered Part D drugs for the rest of the calendar year. That cap is a big deal. It protects people with high drug costs from catastrophic out-of-pocket spending. Every Part D plan has what's called a formulary. That's the plan's list of covered drugs. Not every drug is on every plan's formulary, and drugs are organized into tiers, with lower-tier drugs generally costing you less. When you're comparing plans, always check your specific medications against the plan's formulary. The plan that looks cheapest on paper might cost you more if your drugs are on a higher tier. You can compare plans side by side at Medicare.gov. Just click Plan Compare. Just like Part B, Part D has a late enrollment penalty if you go without coverage too long. If you don't have Part D or other creditable drug coverage for 63 or more consecutive days after your initial enrollment period ends, you'll pay a penalty added to your Part D premium. That penalty stays with you for as long as you have drug coverage. If you have good drug coverage from another source, keep your documentation. And when that coverage ends, sign up for Part D promptly. So let's put it all together. You have two main paths. Path 1, Original Medicare. That's Part A plus Part B. You can add a standalone Part D drug plan. And if you want help with your 20% coinsurance, you can look into supplemental coverage. Path 2, Medicare Advantage, which is Part C. This bundles Part A and Part B, usually includes Part D, and often includes extra benefits, but comes with network restrictions and plan-specific rules. Neither path is automatically better. The right choice depends on your health, your budget, your doctors, and your prescriptions. If you want personalized help comparing your options at no cost, contact your state health insurance assistance program. SHIP counselors are trained, unbiased, and they don't sell anything. You can reach them through shiphelp.org. Or you can call 1-800-MEDICARE, that's 1-800-633-4227, and ask for your local SHIP. Coming up in the next episode, we're going to talk about Medigap, Medicare Supplement Insurance. If you're going with Original Medicare, Medigap is how most people protect themselves from that unlimited 20%. We'll walk through what it covers, how it works, and when you can buy it. I'm Val. Medicare doesn't have to feel like homework. Let's figure this out together.